All right, so we got interesting topics today. Well, I might as well turn the projector on. That might help for you guys. Overcoming attitudinal barriers, and there's a lot of different layers to overcoming attitudinal barriers. Um, not only stereotypes, but also just like how we want to help someone and what our role is, and what is the mindset we have to have. We've talked about similar topics to this a lot. We're going to dive into it a little bit more today. So here's our learning objectives. We'll come back to that. So, we're in a field that we want to help people. We're going to come across a lot of people with a variety of disabilities. And a lot of times the initial exposure to that can stir up a lot of different emotions. How many people in that first video we saw those kids with various problems and various disabilities in the school setting and had some feelings about those kids, whether it was the kid with meningitis, the kid with CP, you might have felt any of these, maybe some different ones. Um, guilt is a real common one. Geez, I'm fine. That person's got some real problems. I hear that one a lot. Geez, I'm fine. That one's got big problems. Uneasiness, pity, probably pity. I think like, oh, I wish that person didn't have that. That's a real common one. And I think actually we in this field have that a lot. And it's not necessarily like it can be a negative thing, but we care about people. Like we wear our hearts in our sleeves, basically. That's why you're in this room right now. So that's an easy one to have. Um, but all of those responses can alienate our patients from us. And how we choose to see their disabilities can interfere with our ability to see them as the capable people that they are. We've got a lot of different ways that we can look at that. Um, but so if you don't have any personal experience with anybody with disabilities, then the common ways we do get exposure, different literature, media, telethons, a few different ones in Rhode Island, the Meeting Street telethon that happened just a couple of months ago. Um, let's literature, books, plays, media, TV shows, movies, um, any other podcasts about somebody with a disability, things like that. Um, So there's a lot of different exposure we get, and sometimes it's realistic, other times it's not. Um, so some examples of some realistic is House MD. That's a really, again, dating myself. That show was popular in the early 2000s, I think. It's probably 20 something years old. But anyway, I mean, that was a guy who had a big leg accident, ambulation problems, and it was always like a subplot throughout the entire series, and then sometimes it would come into the forefront. Um, and then Walter White Jr. is probably a little bit more recent. When was that show? That show was really popular for a long time, but when was that like a big hit? That like 13 is when it was. So, yeah, geez, even then it's over 10 years ago. It's recent for me. But anyway, I mean, Walter White Jr., he had cerebral palsy, ambulated with, we call those Canadian or forearm crutches. So, and that wasn't really a major point of the show. Every now and again it would prop up, but it was just Walter's son, and they basically just lived their lives. Um, Different is Hunchback of Notre Dame. That's a real classic one. I mean, that one's Lenny Small of Mice and Men. If anybody's read that book, Phantom of the Opera. Those are more literature related examples. Some other negative examples. I would say all of those have negative examples to it too, right? Lenny of Mice and Men was dangerous because of his low intellect, and so that's a man. If did everybody? I know I read that in high school. Is that still required reading? No, you didn't. You, okay. Anybody not read this? And I wonder what I gotta, you didn't. What did you have to read any like what did you have what was required to read? Do you remember any novels or any The Odyssey? Yeah, all right. Yep. Okay. I'm trying to think of the Odyssey. I just remember the sirens in the Odyssey. I don't remember anything other. Is there a Cyclops right with one eye, right? Yeah, I'm gonna keep going to you for my literature. No, you're the one that. But anyway, I think all of these, if you have any reference to them at all, like all of those historical literature examples, like they had some sort of problem, and that became why they were an outcast, why they were dangerous, why they were, the misunderstood, maybe. Some other negative examples, man. If you can think of a Disney movie, who's the bad guy? Who's the villain in that? It's with one exception I could think of, it's the person with the scar on their face, Scar from Lion King, Captain Hook from Peter Pan, right? So he's missing an arm, half of his arm. So he is the bad guy because he has a disability. What other Disney movies? My daughter's just getting into them now, so I'm a little outdated. What's the one that I don't think is true is was it Sleeping Beauty? Wasn't that villain? Wasn't she beautiful? And then she said, "Oh, now the most beautiful person is here." Snow White. So Snow White. That's the one I could think of that the villain doesn't have some sort of physical impairment that would say, "Oh, that's the bad guy." But man, you even non-Disney movies, go watch any action. The bad guy has some sort of disfigurement. There are other positive examples. Marvel's Daredevil. Anybody? Tell me more about Daredevil because I looked into that a little bit, but I'm blanking on why I put it up there. Oh, okay. Yep. Gotcha. Um, The Good Doctor. That show still on? It's a relatively new show. Doctor is autistic. Um, I'll talk about that language in just a little bit. Um, so I will say they're listed here as positive examples, although they can also be negative when we look at our patients. So if your patient is blind, you would, if you're Daredevil fan, you might think, oh, all of your other senses are superhuman. No, I just can't see, man. Like I can't fight crime because I can hear someone walking better than you. And then same thing, someone who is autistic, um, just because you're autistic doesn't mean you're also a genius. It's just sometimes process the world differently, right? So if you meet someone who is autistic, you shouldn't just say like, "Oh, so you must be really incredible at something." Um, yeah. And sometimes that fixation is what creates them to be really high level. Actually, I think it was I forget if it was Kyrie Irving or someone else who said that he thinks most people in the NBA are autistic or on the autistic spectrum. And you think like, well, if you're that obsessed with in order to be a professional athlete, you have to pour every single ounce of your life into it. So I, I forget. Yeah. Oh yeah. Hmm, that's true. Yeah, and I mean, we're gonna based on what we've looked at here. Do you think anybody wants to be open about their differing diagnoses or different? Yeah, like there's a lot of reasons not to because we have all of these negative feelings associated with someone who is different for some reason. But guess who our patients are? They're different. Either they have some sort of condition that they were born with, that they've grown up with, and or they've acquired something that has impacted them. Any other examples you can think of? People with major media examples or celebrity. There you go. There you go. And that was the major point of the story, right? So because he's got, and at the beginning of the I think the dad fish was like, oh, you can't go over there because you can't swim fast as less. It was a very lift. So yeah, that's a major storyline. So yeah, definitely. That's a really good example. Yeah, any others? Um, so it's easy to see like all of our examples that if you don't have personal experience, then how what we've grown up with has implanted some biases in us. So we watch Nemo and we say, oh, anybody with an, some sort of physical disability can't do all of these things. But that's not our job, right? Our job is to really empower. What's the vision of what is physical therapy? To improve quality of life, and yeah, it's to what is it? And enhance the human experience. So we want our little fishes to go swim with the rest of the gang. That's just the school, and whatever else that might be. So we really want to look at the individuals with disabilities, not disease. Um, really looking at what that person is, and let's really appreciate who that person is, just like we do for any other patient or any other person. I hope. Um, Sometimes it's really helpful to volunteer in organizations that allow time to interact with people with disabilities. Special Olympics is a phenomenal association. They do amazing work. And then identify some similarities that you do share with the individual. Promote equality between healthcare worker and patient is something I think we are already talked about that quite a lot. We'll talk about it a little bit more. But I think equality for the patient is really important. I was just working with somebody, look for opportunities to treat the person as an individual, not the disease. I work with a person, he has advanced dementia. He's almost nonverbal. He can speak when he wants to. He usually doesn't, and when he does speak, it's usually at such a low volume. It's really hard to hear him. Um, the people who are around him more frequently can translate really well. You ever see do that with a kid when they're learning how to talk? Like their parents know what they're saying, and you're like, "How did you get milk out of that?" Well, because I've been around. So that's what is helpful with him. Um, so he's got advanced dementia. When he tells me, "Hey, let's do one more set of these sit to stands. We're going to do a few more." When he tells me no, I listen. And the other caregivers might sometimes they at least initially they ruffled their feathers a little bit at me, and I just said, listen, this guy doesn't talk a lot, and when he does, I really want to respect him and his message, and yeah, that message might change in 30 seconds, but right now he's saying no, and I'm definitely going to respect him and his wishes. That's an easy example of something that happened earlier today with me on really looking at that individual and not saying, he's got dementia. Let's just do it. Come on, let's go. All right. So, anyway, so equality for the patient is really, really important. For all of our patients, we've talked about that a lot. Just sitting at eye level with your patient instead of standing over them in the hospital or nursing home setting. But there's other ways that we create distance. The uniforms is a big thing, especially in the hospital and nursing home. Man, if you want to feel exposed, spend a weekend as a patient in a hospital or nursing home. When you're wearing nothing but a Johnny's that one piece head to toe gown with a couple of strings to hold it together. And yeah, you want to feel exposed. Yeah, you wear that. access to medical records and knowledge as well. The physical layout of most healthcare facilities is confusing. If anybody's ever visited a hospital and tried to find how do I get to room 304, man, it can be really intimidating and confusing. Part of the clinical rotations, I go visit all of these sites, and there are some sites I'll just call to see. I say, hey, there's one hospital that I go to at least once a year, and I just say, listen, man, I know I've been here 5 times already. Can you just meet me at the front door? I can't find how to get to you because I got to take this elevator, then down the hall, then a different elevator. Can you just meet me? I'm not going to get there. Other things that we can do is really looking at the importance of language. So we don't want limiting language, and there's a lot of ways. Language is so powerful. Few different important ways that we'll talk about today. But things like "you poor thing," right? It's demeaning. It's belittling of the patient, making them feel smaller. Confined to a wheelchair. I think you've heard me say, and here I try to use the words use wheelchair for locomotion. Have you heard me say that before, or use the term locomotion instead of walking or gait? Other things are an inspiration to the rest of us, like propping them up as something again like superhuman, like you're so inspiring. Like I'm just Larry with a hurt shoulder. So other inappropriate terms when the status of the relationship would affect more formality, that can sometimes, that's a really tricky one for us because again, we get really connected with our patients. So we have to draw the line of those things. And sometimes we draw the line, our patients giving us nicknames like that. That's like, hey, can't call me that here, man. Or ever if you don't like the nickname. But the big thing that I want you to understand is the person first language, where we identify the person before the disability. So instead of saying disabled person or disabled people or lame person, we say persons with a disability, person who uses a cane. One exception I'll talk about in just a little bit. So the tricky thing in the inpatients, and also we have to worry about HIPAA, right? That's that patient privacy. So using the patient's name when you're not at risk of breaking HIPAA is what I would suggest. Because ultimately I'm working with Larry. Larry also has this knee replacement. Larry also had a stroke. Larry also had, all of these other things maybe. Larry might also have Down syndrome or whatever else it might be. But I'm working with Larry to enhance Larry's human experience. So I always try to use the person's name when I'm not at risk of breaking hip. But the way that where this becomes important, especially in hospitals and nursing homes, it happens a lot. Oh, the knee in room 304, the back in room 215. Like when we're identifying these people as their injury or their problem, the heart attack in 608, we're not even talking about the person. We're only talking about their condition. They're only identified by their condition. And I don't want to be labeled as, I got a heck of a lot more going on with me than just this knee. So using person first language is a step towards making sure we all understand that there's a person that's at the center of this and not just whatever reason we're talking with them is. The one thing I have been educated on disagreeing with this, in the autistic community, there's a big resistance against using person first language. And actually, I was lucky enough to have a student who was autistic. And she bravely stood in front of the class to talk about her experience and why she disagreed, and a lot of the autistic community, because What they say is when you use person first language for other people, that's probably really good because it is a person with a knee replacement, it is a person with a back or a heart attack or whatever. Um, but what this student had said is you can't separate autism from who I am. I am autistic. It impacts everything. It impacts how I think. It impacts the hobbies that I like. You cannot separate me from how my brain works. It's how my brain processes the world. I don't like looking people in the eye. I don't like standing up here talking to you. You know, whatever it might be with them. So that is the one exception I've come with, and I still mess it up because I still use person first language with autistic people. Um, Student with autism, autistic student. That is person first language versus disability first language. So that's the one tricky thing about it. Yeah. I will. It is entirely individualistic for what they might prefer. I was illuminated from this student of mine in this very class that talked about it. Where I think in most other cases, yeah, there's not a knee replacement community that says I've got a knee replacement, right? But I think in the autistic community, there's a bigger debate. So that's something I want to think of. On the text, we're going to talk about the importance of person first language and why it's important. And because we're looking at the person enhance their human experience, not their disability to enhance that disability, right? So, um, so it's just something I wanted to add. It's a little complex. The other thing is we can promote more dysfunction with our language. And we do this all the time. And it's terrible. Saying someone has a bad back, bad leg, that's a real common one. Especially when you teach somebody how to go up and down stairs safely. Go up with the good, down with the bad. Well, now they have a bad leg. Guess what they're going to think in 10 years about this leg? It's my bad leg. Um, have you guys ever met someone who has a bad back and that's now become part of their identity? They're no longer Aunt Nancy. It's bad back on Nancy. So that's kind of the importance of why we don't use those terms because sometimes you have someone, is that what you're smirking about? Yeah, I bet you we all have them in our family. Um, so yeah, how much better would that person's life be if they just didn't perceive their body as bad? Got some complications, sure, maybe some limitations, things we have to be careful with, but we don't have to have it identify ourselves. Um, it can also promote a sense of helplessness. So, stroke victim. One of the other terms, actually, there's one test that we use that measures burden of care. And I really hate that term because, man, no one wants to feel like a burden. So, when we talk about, oh, you scored this number on this test, that means you're a high burden of care. Well, that might be true. It's really impacting a negative to the person. Um, can make people feel less than using the word normal, like a normal leg or normal people. Oh, what are the other normal? What do the normal people get on this test? Oh, you scored this. I don't know. Um, Also can increase fear. You have a degenerating spine. You know, the back of an 80-year-old is a common one I hear. You're a fall risk. Yeah, some people are a fall risk, and some people's lives are greatly altered by their fear of falling greater than their actual risk of falling. And now that's a big problem. Um, so really, we got to be really, really delicate with our language and how we communicate with our patients because we don't want to lead into these fear behaviors or these dysfunction related behaviors? Um, so I think a lot of times we want to try at least or to fix the problem for the patient, but oftentimes results in anger, frustration of the provider, especially if the patient has unrelenting demands, difficult personality. That's going to happen a heck of a lot. But we can separate our feelings of sympathy or anger from the patient situation from our tendency to want to help on the based on our perceptions. Um, so what would be the greatest value and greatest benefit and likely a change? What the patient's goals are, and that some elements might not be within our professional realm. Talk about it with patients driving. Their patient's goal is to get back to driving. They haven't driven in 5 years. Okay, well, that's outside of my professional realm, but I can do all the physical therapy related things to get you towards those goals. Physical therapy related things means we got to get out of the chair, we got to walk better, we have to have better balance, we have to have better endurance, we have to get coordinate everything. So all of that is really important. And my wife does a phenomenal job. She has more, obviously, she's kids with disabilities, so this is her whole profession, and it's aspects of mine, although a big aspect. Her goal is to get these kids back playing with their friends. What a beautiful and simple thing. And really, if even if we think of it with adults, how are we going to get these adults back to playing with their friends? And playing with their friends might mean go to work as an accountant and just sit in your cubicle for 8 hours, but like, fine, that's big. Um, so all of that is really, really important. And when we have these negative feelings to start with, we really have to make sure we understand what our goals in physical therapy are, right? What are our goals in all of physical therapy? Improve current level of function, return to prior level of function if applicable, and minimize consequences in the future. We can always maximize today's current level of function. That might mean getting the kid to be at recess better, whatever that means for that kid. So So some different laws that impact individuals with disabilities. Rehabilitation Act of 1973 prohibits discrimination against individuals with disabilities by the federal government, includes some civil rights legislation, promotes discrimination by anyone receiving federal dollars, like in hospital reimbursed by Medicare. Every single healthcare entity receives some federal money, so uh, Individuals of All Handicapped Children's Act, later reissued as Individual with Disabilities Education Act. One of the things I like about learning the history of laws is just seeing the importance of language already, right? So when in 1974, Education of All Handicapped Children's Act, what that did was make sure that kids with disabilities got an education and weren't just sent to a state-run, basically a nursing home, and just kind of put to the side. So, phenomenal piece of legislation. How do you guys feel about that word handicapped children? Not person first language, right? So that, children who are handicapped would be person first, not necessarily, but that word handicapped is something that has grown out of fashion. So Individual with Disabilities Act, now that's person first. And now we're talking about disability instead of handicap, better wording. Um, so what this did was, one, provide educationally relevant therapy services to kids with disabilities in the school system. So that's why every single school system has some level of physical therapists, occupational therapy, speech therapy to enhance the supportive services to enhance the kids' education. It also, I forget what FAP, LRE is the least restrictive environment. So that means that before 1997, before 1974, kids with disabilities were just could have been just sent. They didn't need an education, they need to go to school, and a lot of times they would be sent to a state-run institution and just live there. But prior to 1997, a lot of the times the special needs kids would go to the special ed classroom and just be there and never really be with their peers. Yeah, they're in the building, but they're not with their peers. So 97 on, it really defines what mainstreaming and least restrictive environment is. So if this person can go learn math, but they need a one-to-one tutor for it, we're going to get them a one-to-one tutor to sit with them as they learn math in the math class. So two big things for that. Americans with Disabilities Act. This is something that I talk about a heck of a lot, and I use a heck of a lot. So it covers four major things: employment, public service, public accommodations, telecommunications. Did we talk about this at one point earlier this semester? Measure, we didn't go in depth with it. So it prevents discrimination against people with disabilities. So the employment means that if the potential employee can do the essential function of the job, it's up to the employer to provide reasonable accommodations so that they can do that job. So if I use a wheelchair for locomotion, could I still be a professor for you guys? Absolutely. What do you think? What would be a reasonable accommodation? Yeah, I think this desk is a little too crowded for me, and we either have to move some furniture around, which would be easy to do in this room, or find a bigger classroom. Do we have we don't have an order. We do have an auditorium on this. Is that stairs or ramp on that one? Both. All right. So, I mean, if I needed to teach a gigantic lecture class, is that accessible? Can I get on stage or not? Right. So that kind of like logistics. What is not required is undue hardship, which means that the accommodations that are required are unduly costly, disruptive, or substantial to the business. That happens a lot actually with these older buildings that we have around here. I know this restaurant in Newport. It's an old Perro Salado. Has anybody been there? Pretty good Mexican food. It's an old house that they turned into a restaurant. Anybody think of something like that they've been to? Yep. So if I had used a wheelchair for locomotion, I wanted to be a server. I really can't at Perro Salado, and especially because it's an old historic building, they're not putting in the cost of a elevator to allow me to do that is extreme, and it also interferes with the historic. Part of the charm of the place is this is a quirky, fun old house. So that's what the undue hardship would be. If I said I can only teach online classes. All right, well, that's substantially changing the business of this profession. Like, yes, we have online classes, but the physical therapy curriculum is not online. So you can't, it would be too disruptive to do that. Different than if it was just MedTerm. If that's all they were hiring me for, hey, I can teach MedTerm all online, no problem. So it's not required to force the business to undertake undue hardship. It also covers access to public services, local and state governments. In North Kingstown, where I live, this was a big problem for a long time. Our town hall was a historic building that was not accessible. And it cost a lot of money. And anyway, for a number of years while they were fixing up the historic town hall, we had to change town halls into a accommodating building because people need to vote, that they need to have access to speak up at their town hall meeting, school committee meeting, all of these other things. Like whether you do or not is up to us as Americans to decide whether we want to or not. But you can't prohibit someone's access because they can't physically get in and out of there. So that's what that means. Public accommodation, hotel rooms, parking spaces, at least 2% of parking lots need to be required for handicap accessible. So where we get into a little bit of trouble, when I was teaching at New England Tech, they were doing a big addition and they had to change around the parking lot. And where they were doing the addition was in the closest parking spots, which are the handicap spots. So they had this whole big problem of, well, we're moving those and we can't just move them there. We have to move them over here. But now we're changing the number of, 2% has to be deemed handicap accessible. Now we're changing the number of parking spots. So how does that impact? It was a whole big problem. But yeah, at least 2% of parking spaces. Hotel rooms, 2% of hotel rooms need to be deemed handicap. Anybody ever grab a handicap accessible room by accident? I mean, sometimes it's just the last room. Tell me about it.
It was very wide.
Yep.
It was much less expensive. It was more on the floor level.
Yep. Yeah. Huge bathroom. Walk in, roll in, walk in, shower. Yeah. If you ever have an opportunity, they're pretty great rooms. And then also telecommunications. So closed caption TV started because of this Americans with Disabilities Act. And I think now, most videos online have closed caption on it, right? That all started because of the Americans with Disabilities Act. HIPAA, we talked about before. Did we go into it a lot, or? So HIPAA, Health Insurance Portability and Accountability Act. There's a bunch of things that HIPAA does. Protects insurance coverage for their families and people who lose jobs, limits exclusions. But the big things that impact us probably more frequently is security, electronic transactions, and privacy. Of course, all providers who transmit patient info to adhere to guidelines and type of information they can disclose, who they can disclose it, and how they can store and protect the patient's confidentiality. My computer system for my patient care, I have to have 2 separate passwords to get into it. One to unlock the computer and another to access the software. So there has to, when we had paper charts, we used to say it has to be double locked. It means it has to be locked in the filing cabinet and the door to the filing cabinet room has to be locked. So it's a double lock. That's the electronic double lock is multiple passwords. But what information can we disclose and who can we disclose it to and how much information? That is all stuff that's really, really important. I can't go talking about, I can talk about my patients freely as long as I leave out any identifying factors. So if I said, oh, the person in, what's the town I don't visit? Oh, Westerly, I don't visit all that often. I was seeing a patient in Westerly and they had a heart attack and they were 55 and they live in a big house. And then, man, Rhode Island is small and it's amazing how small it can be sometimes. There might be one of you that goes, you see Nancy? It's not that far-fetched to think about. So I have to be really careful on how I talk about patients, just in this classroom environment. But also any other information too. Actually, my wife and I, because we're both physical therapists, whenever we're out in the community, we see someone, someone will always come up to us and talk, and then, oh, how do you know that person? We both look at each other and go, I can't legally tell you because HIPAA. Now, what I can do, so sometimes my patients need new equipment and I have to call a vendor. We don't sell walkers, we don't fulfill those. I can call these vendors that do all of that and I can say, here's the patient's address, date of birth. I can tell them their insurance information, primary care provider, diagnosis and why they need, height and weight if they need equipment that matters too. I can tell all of that information because that vendor needs that information to fulfill their job, right? What I can't tell them is say, hey, by the way, be careful when you knock on the door. They're on some bipolar meds, and sometimes loud noises triggers them. That's not actually part of my job to disclose that amount of information. That now has we've broken that. Um, I will. The one example of us, a company I work for broke HIPAA. I think I told the story, but I might not have. Patient's wife called up the clinic. Did I tell you about that? Patient's wife called up the clinic and said, "Oh, was Larry at PT today?" And the front desk person says, "Oh, no, Larry, we haven't seen Larry all week." That son of a, he's been cheating on me. The guy was saying he's going to PT 4 times a week, and at least twice a week he's seeing the girlfriend instead of coming to PT. That was a HIPAA violation. It was not, even though she was the emergency contact, it's not an emergency. We're not supposed to confirm or deny the fact that he's the patient or not, especially if he came or not. Like that's not part of the, we don't need to disclose that information. Innocent mistake from our worker standpoint. Um, Luckily, the guy had more problems on his plate than to complain about our HIPAA violation, but that is a HIPAA violation. So yeah, and I mean, talking to people in public, oh, I know that person, they were a patient of mine. Oh, talk to like that can't happen. Um, there's plenty of times that I work with people who are friends. Oh, I'm going to go see my friend Nancy. Linda's going to come over, and I know both of them. I treat both of them, and I'm not saying anything about that. I hope you guys have fun. Oh, I saw Nancy earlier. Tell her I said hi. Like that, you can't do anything. So all of that is really important for HIPAA. There's other things, like I said, about electronic passcodes and how we use that, how we store, transmit information, all important. All right, we got to go back to the objectives. All right, an awareness of stereotypical reactions. What are some of those feelings, reactions, some common ones? Fear, guilt, pity, uneasiness. Those are the major four. And then there's others. There's definitely others. Fear is an interesting one. Not only I'm afraid of the person with the scar across their face because I've been taught through Disney movies that people with scars on their face are the bad guys. Um, but also fear of like I don't want to hurt this person. That happens a lot. Like you're not going to just work on their leg. They're not some fragile thing because they have Down syndrome or CP or something else. Like, yeah, we want to be careful that, but yeah, it's an irrational fear. They're not all of a sudden magically fragile because of the some conditions, maybe. But, yeah, good stereotypical reactions. Um, Mechanisms which fosters inequality between healthcare providers and patients. What are some of them? Access to medical records, yep. Knowing just the physical layout is definitely something, and then uniforms is a big one. Yep, yep. Um, Going back to team models, man, if my patient's in a Johnny and we're going to do a bunch of PT, I wouldn't really want to do exercise wearing just a Johnny. Um, so maybe one of the things we can work with our one of our counterparts, which member of the healthcare team would help us think about dressing and is this appropriate or not. So maybe the CNAs we could incorporate with, hey, I'm going to work with this person at this time. Can you help get them dressed? That would be great. Anything else? Any other members of the healthcare team that might help us with that? I think OT would be the other one, right? So can they dress themselves? Do they need to have help learning how to dress themselves or coordinate, whatever that might be? So that would be, but also We also have to incorporate the nursing staff. If we put a sweatshirt or sweatpants on, is that going to negatively impact how you give care? So we have to be, it's a whole team thing, but yeah, it can be really important. Uh, Examples of people first terminology. Person with Down syndrome is a great one. Yeah. What was your hip injury? You had shared it before. Yeah. So person with labral tear, not labral tear. Yeah. Yeah. Because you're a lot more important than that, right? Yeah. And just to kind of emphasize that well, the next one we'll talk about that a little bit more. Any other examples of person first language? I think you got two great ones. Impact of language on perceptions. What were some of the examples with this? Bad leg, bad back. Yep. Fall risk, yeah. So that fear type. So yeah, yeah, and bad leg and bad back can also add to that fear too. Um, so Kim, you had a labral tear and it was surgically repaired, right? Is that what you had said? Um, how would it feel? How long ago was that? So how would it feel if someone were to say, well, this hip will never feel the same again? Yeah, yeah. And you know, you're a young, fit man. Man, if we tell a 20-year-old that this hip is never going to be the same, oh, this hip will have arthritis way earlier in life. Like now I've think of like just those kind of terms could shift the rest of your life. Now I'm afraid to exercise. And now what happens to somebody who's afraid to exercise? Weak, become sedentary. What happens to people who are weak and sedentary later in life? All the like the problems start to accumulate just because of that. If we were to tell you 4 years ago, this will listen, this will never be the same. Oh, we don't know that. Let's just go for it. Let's go. So yeah, really important. And that can be as simple as when we taught you how to walk with crutches. Bad leg goes with the crutches. Well, now we might have just implanted in your brain that you have a bad leg, and the rest of your life you're afraid to do something on that bad leg. So yeah, yeah, really, really important. I was actually just had somebody lecturing about chronic pain, and a lot of times it's that perception that there's a problem is much more difficult and much more negatively impactful than having an actual problem can be. Um, so anyway, uh, how literature historically presents individual disabilities and its effect. What do you? A handful of ways. Give me kind of spitfire a few of them. So I think in literature, Hunchback of Notre Dame, Phantom of the Opera, Lenny from Of Mice and Men, those are the major literary works. Um, any other literary works that you can think of that? Yeah, maybe. Yeah, yep. Yeah, probably. How about the Odyssey? Anything ring true in the Odyssey that specifically says, yep, yep. Um, so, but I mean, the general theme in history is if you have a disability of some kind, you are bad. You are to be conquered in general. You disagreeing with that? Okay, there you go. Yep. Um, so that's something. How media historically presents individuals with disabilities and its effect. How about other media, more modern media, TV, movies? Yeah, so there's some effect of if you have a disability, you're now superhuman in some way. So intelligence with a good doctor, other senses with Daredevil, yep. Um, oh yeah. Oh, yeah, I don't remember that one. My wife loves that show. Yeah, she definitely would. So yeah, so one of the ways is if you have a disability, you're superhuman in some other way. That's a common one. Any other? Yeah, no, it is. It is. Yeah, I think it's a unique. I think the ways that disabilities are portrayed that are more realistic are much more uncommon. I think historically, media, just like Disney movies, like the bad guy is the one with this disfigurement of some kind. Um, so, yep. Um, the one I will also just pause on for a little bit, telethons. So telethons, I think the purpose is oftentimes great. Meeting Street, if anybody ever gets a chance to volunteer or take a tour in Meeting Street, it's a school for people with disabilities. It's an incredible school, and they raise money for to keep that school going. They do a phenomenal job. And there's a handful of other telethons out there trying to raise money. What a lot of the commercials or those telethons are feel bad for these kids and give us money. Like they're preying on that pity effect. Like, don't you see how bad this is? Like, we need your money to make it less bad. Um, so that is one way history. So when we have feelings of uneasiness and pity and things like that, it's like, well, because kind of it gets shoved down our throat a little bit too, right? Don't you see how hungry this kid is? Give us money so he's less hungry. Like even in little commercials like that. So what's the Rehab Act of 1973? Prohibits discrimination against individual with disabilities, including civil rights. Prohibits discrimination by anybody receiving federal money. Good. How about the IDEA? That was the education one, or a couple of the take-home topics for the education one. So services are provided relevant to enhancing education. Good. And I think the other major points are the mainstreaming, least restrictive environment. Yeah. Um, Americans with Disabilities Act, a few different things. There are four subtopics of that. So an employer has to provide reasonable accommodations. Can't just say we can't hire this person because of a disability. Yep. Any other major things? Public accommodations. Yeah, how do we have access to local government was another one. Public accommodations, including hotel access. Uh, that also means right down to the type of handle on that door. It's a lever type handle that lever type handles infinitely easier to open than a knob, like the circle spherical ones. In fact, so much easier in some of these older apartment buildings. I see this. Um, oh, there we go. There's an example of one. So there you go. If you have trouble opening it, you can get an aftermarket. It just screws in, and that guy looks like he's ready to sell us some stuff. So anyway, it's just an add-on. You get to put it on a knob, and then it becomes a lever type. Um, my son, we switched, we got new doors, but back when I had one door in my house that was a lever type and the other one was a knob. And, we would always have to lock the lever one because he could exit that one. The knob one, we never had to worry about because he couldn't actually turn it, but the lever one. No. But yeah, the Americans with Disability Act says if you're going to have a building that with public access to it, you need to have lever type handles on the doors. How high up they are off the wall, how wide are the doorways, all of that. Building codes are all part of that. How about HIPAA? A couple of things it does, but the major one it does is what? Patient privacy and confidentiality. Yeah. Yep. Good. All right. Any questions? All right. I got a couple other things I want to do with you. Let me just pause this.